as I have already told you that cardiac cycle can be represented with the help of diagram and with the help of graph. So diagrammatic representation already I have made. Now if we look at graphical representation of cardiac cycle, then just look at this board. I have drawn the diagrammatic representation is there. Now with the help of this diagram, we will make a graph. So first, if we look at, this is atrial systole. This diagram, actually atrial systole. What I have said, there is a contraction of the atria. So what will happen? The pressure in the atria increases. Because of this contraction, pressure in the atria increases. So here, this is the y-axis and this is the x-axis. This is representing the pressure that is given in millimeter of mercury, and here the phases of cardiac cycle. Total duration is 0.8 second. From this to this, it is 0.8 second. So we will see the volume and pressure changes during cardiac cycle and how we can represent with the help of graph. So that is a graphical representation. So atrial systole, if we look at the pressure in the right atrium, pressure in the left atrium, it is increased in, there is the first phase is isometric, it is the systole. The systole, atrial systole, pressure is going up. Atrial systole, the pressure is going up. This is the systolic, that is the atrial pressure. This color is atrial pressure. And then the ventricular pressure also will increase. This color will represent the ventricular pressure. So because of entry of the blood, little pressure also will be increased. So that is the ventricular pressure. And then the aortic pressure. If we make another color, so this will remain like this. There will be no change in the aortic pressure. So this is the aortic pressure, which is the 80 milliliter mercury. Here the pressure at the time of systole, this is the atrial systole, pressure is increased up to 5 millimeter mercury or 7 millimeter mercury, and this is the ventricular pressure. Now the next stage is isometric contraction period. In this isometric contraction period, we have started the ventricular systole. In this, the closing of the valve, here we have the first heart sound. Here we have the first heart sound, and the pressure here in the right, if we talk about the left atrium, the blood enters here, keep entering here. So the volume increases. So volume increases here. So this is the volume increases here. In this, which one? It is the isometric. This phase is isometric contraction period. This is the isometric contraction period. This phase is isometric contraction period. 0.05 second isometric contraction period. And what about ventricular pressure? Ventricular pressure will be increased. Isometric contraction period, ventricular pressure will be increased. And here there is no change with the pressure. Now come to the next is ejection phase. In ejection phase, the blood enters here. So what will happen? The pressure in this, the pressure increases. In this, the pressure increases here up to 120 millimeter of mercury. That is the ventricular pressure. And the volume here also it is increased. There is a filling of the atria. So the volume is increased. So that is the A wave. And here, because of the first heart sound, there will be a change with the pressure here, and that is the C wave. That is the C wave we will have, and then the volume increases here. So here in this ejection phase, volume is increased, and the pressure in the ventricle, if you look at the pressure in the ventricle, the pressure also will be increased. Then because of the ejection, first is rapid ejection and then slow ejection. So because of this ejection, the pressure again is coming down. And here we are talking about slow ejection. This is rapid ejection and this is slow ejection. So here if we look at the left atrium, the volume is increasing here, also volume is increased here. So this is the V wave. So we have in the atrial pressure curve, we have three components. One is A, another is C, another is B. A stands for atrial contraction, C stands for closing of the valve, and V is the volume of atria. Volume is increasing here. And if we look at the pressure here, because of this ejection, the pressure in this is increased. Because of this ejection, pressure here is increased here. Now coming to the rapid ejection, slow ejection. Now from this we'll have to start the ventricular diastole. Ventricular diastole, pressure here is reduced here, ventricular diastole, and here also we will see there is no movement here, so it's here the also pressure will be coming down. Which pressure? This is aortic pressure curve. Here there is a notch we can see here because of the closing of the valve, that is second heart sound. We have a notch here, and then the volume keep increasing here. Then next is isometric relaxation period. So in this, the pressure of the ventricle will come down. Isometric relaxation period, diastasis and slow filling phase. Here the pressure will, this is the pressure, ventricular pressure. This is the ventricular pressure. And this is the volume we can see. This is the volume we can see. And then the pressure in the aorta is like this. This is the aortic pressure, this is the ventricular pressure, and this is the ACV wave. So there will be no change with the volume later on. So this will remain constant. Now, so again if we look at the graph here, at each stage, if we look at the pressure and the volume, here this pressure, this is the atrial pressure, and this is the ventricular pressure, and this is the aortic pressure. So this correlation we can see, and we can represent this graphically. This graphical representation will help us how the pressure is changed in three chambers: atrial chamber, ventricular chamber, and the aortic chamber. I like to request audience, if you have any confusion in understanding cardiac cycle, both graphical representation and the diagrammatic representation, please pass your comments. Don't hesitate to pass comments. You must pass your comment, then only I can change myself. I can try my best to help you. I will try my best to go forward. Thank you.